viewers, this is Dr. Hiya Agarwal from Neelkanth IVF Jodhpur. Today we will be discussing about 6 tips to improve IUI outcome. Let's start with what is IUI. So IUI full form is intrauterine insemination. It is one type of fertility treatment which is usually given to the patients who have no cause of infertility, which is also known as unexplained infertility, or to the patients who have subnormal male parameters which are not that deficient. Like the count of the sperms is around 10 to 15 ml and the motility is slightly decreased. So in these patients, we can employ IUI technique, which is also gives a success rate of around 20% per cycle, and it is a much less costly treatment than IVF. These kind of patients can achieve success with IUI. Therefore, they are given around 2 to 3 cycles of IUI treatment. If they do not succeed with IUI, then they are proceeded to IVF. So there are certain patient things which can be done by the couples which may help to improve the success of IUI. These tips include: first, healthy diet. Healthy diet importance cannot be superseded by anything. Even if we give the best of fertility treatment, then also a couple, and especially the woman, having a healthy diet which is rich in the proteins, vitamins, minerals, they will tend to have better fertility outcome as compared to the couple who does not have the healthy and a balanced diet and a good lifestyle. Couples should improve their diet in leafy vegetables, in fruits, fresh vegetables, should avoid canned foods, should avoid stale food to improve the fertility outcome. Second tip to improve the IUI outcome is exercise. I'm not asking you to hire a gym trainer and go for a strenuous exercise as of start. It's better you go for a natural, normal exercise like a regular brisk walk, like jogging, light jogging, or you can go for yoga. These help to improve the cardiac load. They improve the blood circulation to the reproductive organs and thus help in improving the fertility outcome. Light amount of exercise definitely improve the success rate of IUI, and every couple should try that. At least do a minimum of 25 to 30 minutes of regular light exercise in the form of brisk walk, in the form of yoga, or you can do light jogging, you can do light swimming. All these things are important. Third tip is be stress free. It is easier said than done. With today's lifestyle, most of the couples are working, and with the added strain of fertility treatment for repeated ultrasounds, repeated visits to doctors, it becomes more and more difficult for the couples to not have any stress in their life. But I would suggest them to improve their quality of life by decreasing the stress elements, and as well as finding things which can help them grow as a couple, which help them bond towards each other and reduce the stress. Even with the IUI treatment, they should try to find happy moments which may help to reduce the stress and increase their bonding with each other. Fourth tip is to, as I said, be happy. Rather than being stressful, try to improve the positive energy in your life by doing something which you like, which may be seeing movies, going out with friends, along with the fertility treatment. I'm not asking you to not go for the fertility treatment. Take all your appointments, but along with that, do things which help you stay happy, like do your hobby things. You can do dancing, you can listen to music, you can go out, hang out with friends. Being happy definitely brings a lot of positive energy in a female as well as in the male, and that improves the chances of conception. Fifth tip is basically avoid certain things, especially, and number one is the smoking. Smoking decreases the blood circulation to the reproductive organs. It increases the stress in the body. It increases the oxidants in the body and thus deproves the quality of the sperm in the males as well as of the egg in the females. So especially during ovulation time, women should avoid smoking, and if it is possible, should quit the smoking at the time they are planning to conceive, as well as throughout the pregnancy. As far as smoking, the couple should avoid drinking. minimize it as much as possible, should avoid other drug substances like tobacco chewing, illegal drug use. All those things should not be done, and the recreational drug abuse should also be is very strictly prohibited. Last point, which has shown to improve the IUI success rate, is basically an intercourse after IUI. Usually, the couples who have come for IUI in our clinic have said that whether we should avoid sex total and we should only go for the IUI. They have these kind of queries. So for those all the couples, I would like to advise that having a sexual intercourse during an IUI treatment is not at all harmful. It is on the contrary very beneficial, because the prostaglandins, the substances which are released in the semen, helps in the contraction of the uterus, and that improves the passage of the inseminated sperms towards the fallopian tube and may in fact improve the success of IUI. So couples should definitely try to have a sexual intercourse after the procedure of the IUI. Along with it, they can have the sexual contact around 2 to 3 days prior to IUI also, or on a regular basis when they are going for a fertility treatment. They should avoid the contact just 1 or 2 days before the IUI to improve the semen parameters when the sample is being processed for IUI. Last and the most beneficial tip for improving the success of IUI is basically having sexual intercourse just after the procedure of IUI. It is actually surprising for a lot of couples to hear this, and a lot of couples who come for the IUI treatment have the query that whether we should have the contact, whether we should completely avoid the contact. To all those couples, our answer is no, you should not completely avoid the contact. It is better to have a contact during the fertility treatment, and it is definitely beneficial when you have the sexual contact just after the IUI procedure, because there are certain substances which are released in the semen which helps in contraction of the uterus. So they will help in the procedure of the sperms to travel through the fallopian tube, because the uterus contracts and thus it pushes the sperm towards the fallopian tube and hence improve the success of IUI. They can also have contact during the fertility medicines which are being given for development of the egg. They should just avoid the contact around 1 to 2 days prior to IUI, because the semen sample is best obtained when there is an abstinence of 2 to 3 days. So if they avoid that contact, that will improve the sample which is being taken for the IUI. Other than that, there is no need of any abstinence. I hope these tips which I have provided today may help to improve the fertility outcome in your IUI cycles. If you have any other query, or if you want to know more about IUI, you can call or contact in the below given number. Thank you.